The World Health Organization, WHO, has trained about 350 Nigerian corps responders in readiness for deployment within the first 24 hours of an emergency. WHO Nigeria representative Dr. Walter Kasadi Mulumbo said this is essential as preparation and early rapid execution of outbreak response strategies are critical in detecting, containing, and mitigating the spread of potentially dangerous infectious diseases. Lois Abbasambo has the details.
The World Health Organization is training 350 Nigerians on rapid response to tackle health emergencies. Speaking during the onboarding process, the WHO Nigeria representative Dr. Walter Kazadi Molumbo said in Nigeria, emergencies, disasters and other crises increase in number and magnitude daily, affecting thousands of vulnerable and unprotected people, and the situation is not promising to improve soon. Hence, the need for the workforce.
We need to diversify our skills, and that's the essence of this training, building on capacity that already built 12 multidisciplinary teams that can respond to any emergencies within 24 to 48 hours.
On the flooding situation in the country, Dr. Kazadi said the situation has become overwhelming, with over 3 million persons affected, while calling for an effective response from government and institutions to prepare collaboratively for new outbreaks.
The crises we are facing are multidimensional. During the opening ceremony of the Conference of Party 27 on climate change, the outgoing president, mentioned the critical issues facing the world as a result of climate change. He mentioned Nigeria among the critical issues and the floods that are of unprecedented nature, scale in the last decade. So we are heading into a direction where we need to diversify our skills.
Meanwhile, Minister of State for Health Ekumakama Nkama said Nigeria is working with the World Health Organization towards ensuring another pandemic does not take the country by surprise.
Our country is making concerted efforts towards strengthening emergency response capacity at all levels to ensure health security. This is aimed at building stronger health system post-COVID. The COVID-19 pandemic reinforced the need for further robust country and state capacity to prepare for, detect and respond to public health emergencies of international concern in African region.
The initiative tagged Capacity Building, Learning and Training to Onboard the African Health Volunteers Corps, Strengthening and Utilizing Response Groups for Emergencies team is geared towards preparing a workforce that can be called upon when needed, drawn not only from the World Health Organization but mainly from the states, civil society and volunteers. Lois Abbasambo, ASO Television News.